My name is Alex MacLeod. I work on the healthcare product innovation team, and I'm pretty sure you're sick of me already. So Jason will do most of the talking, but I am very excited about this session because as you heard this morning from Francois, we partnered with Clear literally recently. I think the press release went out this morning. And I think this catapults us into a new experience for consumers, which we're honestly not that great at. At least we haven't been in the past, and Clear is a pro at. So Jason?
Yeah. Hi, everybody. Jason Sherwin. I lead business development for our healthcare vertical at Clear. Yes, it is the same Clear at the airport, and yes, we've entered healthcare, although a lot of folks don't know that we have, and we'll talk a bit about what we're doing in healthcare sort of more broadly, as well as our partnership with InterSystems, which we're incredibly excited about to announce today and to bring to market throughout the rest of the year. So raise your hand, since we're like liven up the audience a bit, if you've had to fill out a digital or physical clipboard when you've gone to the doctor in the last year. Yeah, everybody in this room, right? So we're constantly asked to over and over again submit the same paperwork, right? Which patients self-attest. Somebody on the back end then manually enters typically into the EHR, and finally it makes it to that, into that exam room where the clinician will see you and treat you. So, we spend $4 trillion in this country on healthcare, according to a recent McKinsey study. $1 trillion of those dollars are spent on administrative burden, right? Administrative tasks like manually, moving data from point A to point B, oftentimes on paper. And so the clipboard is really a symbol, right, for all of us that consume healthcare in terms of our experience, and we think we can do better. So when you think about sort of identity in healthcare, right, and a lot of what Francois and Patrick were talking about is really thinking about this on the back end, right? Data is incredibly fragmented, both within a traditional healthcare organization, right, where some healthcare systems have 18 instances of Epic, for example, in their own ecosystem. Not to mention the fact that you have all these other ancillary systems that sort of live around the healthcare system, right? You have lab systems, you have imaging systems, et cetera. And so the challenge today, right, is that data is incredibly fragmented, and there are ways, as we discussed in the last session, to be able to pull that information in. Somebody raised a good point in the audience about finding, a user basically self-attesting to a patient's name and date of birth, and how that can ultimately lead to a mismatch. And so we'll talk a bit about how a solution like Clear can actually help in that capacity. Can't talk about identity these days without talking about cybersecurity. And this is both a challenge, obviously on the workforce side, given what we've seen with Change Healthcare, for example, but also on the patient side as well. So oftentimes the way we identify patients are, a patient calls a call center and self-attests to their name and date of birth, and we hope that that's in fact the right patient, but there's a possibility that it's not, right? And so we can do much better in terms of enabling consumers, whether they're a patient or a provider, to verify that they are in fact who they say they are, so that they can get access to the information that they should have access to. And so what Clear and InterSystems together have built is what we think about as a single universal health identity, right? Your health identity is two core components. One is your ID, right? So basically what's on your driver's license, your name, date of birth, perhaps your address, your phone number, et cetera. Your health identity is much richer, right? It's your digital credentials, it's your insurance information, it's your HSA, FSA, it's your allergies, your medications, your family history. And so when we think back to that, example of the clipboard that I was describing earlier, what we do together, Clear and InterSystems, is we tie that verified identity to the robust back-end data connectivity that InterSystems has, and Alex will speak more specifically about what this looks like. And so when you marry those two elements together and you put the patient in control of that experience by verifying their identity and accessing that health identity, we can ultimately enable them to share that information with their care team, with their healthcare system, and sort of any organization they may be interacting with. They can even share it with a family member, for example, if they want to share their information with a healthcare proxy. So what this looks like is, there are different touch points within a patient journey where this could be relevant, right? So Patrick talked a bit about during that first time registration when you're initially scheduling an appointment. So you could imagine, when you schedule that first-time visit, you could actually verify your identity and share your information through, and we'll show a demo of what that looks like. You can do this at check-in, right? Whether that be checking in virtually for a telehealth visit, or whether that be physically at the facility. The call center, right, which I referenced earlier, you may, for example, be calling in to get your lab results and being able to get a push notification to your device, verify your identity, and then consent to share that information with that call center agent to ultimately streamline the experience, because on average, a call center agent will spend a minute or two literally verifying who you are, not to mention the fact that they can start to personalize that journey because you've verified who you are and you've consented to share that information. And so the point is, we can think about the patient, these various patient touch points, and ultimately enable a healthcare system, for example, to make this opportunity relevant to a patient, to give them the ability to share that information. Different different use cases command different levels of assurance. And so we think about identity like this mountain, right? So Mount Everest, for those of you that have experienced what we do in the airport, right? That's Mount Everest for us. We're actually required by the TSA and Homeland Security to physically witness every single individual who comes through our airport lanes. But as you move down that mountain, everything I'm showing on this slide are different ways that we can digitally proof an individual. So for example, you're scheduling an appointment, and perhaps a lightweight verification is enough friction to introduce to that patient to enable them to schedule that visit, because you may only need to know their name and date of birth, for example, because you want to get them into the door, so to speak. But as we sort of lead the patient to the exam room, if you will, there are different levels of assurance that you may want to step that individual up to, right? So for example, document-based basically just means we ask the user the patient to take a selfie. We tie that to their driver's license or other government document and verify that identity. The next level up, which is what we'll leverage in our partnership with InterSystems, is IAL2. So IAL2 is a standard that's been set by the NIST through the federal NIST, which is an agency through the federal government. That's basically an accepted universal standard for identity verification, which is basically that document level with additional corroborating checks behind the scenes. So for example, for any of you that are familiar with the 21st Century Cures Act and TEFCA, IAL2 is actually called out in that use case. A couple of other examples: if a provider is onboarding through the Joint Commission, or they need to prescribe a controlled substance, they can also leverage that IAL2 assurance level. And so what you'll see on the right-hand side here is a demo. I believe it's our LinkedIn flow. So plug for our non-healthcare use cases. If you want to try it out, go onto LinkedIn. You can verify your profile with Clear. But that's effectively being done at that IAL2 assurance level that I'm describing. So what does this actually look like for a patient? So those of you who were sitting in the keynote this morning, you'll recognize Francois's face in this demo. I think he's sick of seeing it himself. But effectively, so imagine, for example, that your patient, you schedule an appointment, it's 48 hours prior to your visit, and you're now being asked to pre-register for your visit. And in your current work, in your current life, that may just be submitting your insurance information, for example. But we can actually substantially reduce the friction for the patient when they show up in the exam room by going through this flow. And so what Francois will be asked to do is to verify his identity with Clear. And this could either be through like a push notification, an email. It could be directly within your e-check-in within MyChart, for example. And then go through a series of steps. Now, what we're showing here is a brand new user to Clear. Keep in mind in this flow that we have over 22 million individuals who have already been verified on our platform. So for them, it's literally just a selfie. But in Francois's use case, he's brand new to Clear. And so he's going to not only be asked to take that selfie, and we're running not only the selfie, but running liveness detection behind the scenes to make sure that Francois is in fact in front of the device. And then we're also going to ask him to scan both the front and the back of his driver's license. And behind the scenes, we're running various checks here. You'll notice we're asking him to enter very little information manually, and most of it's being pulled off of that license, for example. And then this screen is the most important screen. It's probably going to jump off before I can speak to it, but that's where the patient will actually consent to share their data. And so back to the question from the session earlier, Francois can consent to share his data. That will then send it through to the InterSystems backend, and then effectively the screen that was just showed with all the healthcare information can be displayed to the patient, and they can then consent to share that information with their provider. So when you think about the gateway service, right, without Clear, you're looking at pulling that information in sort of when the patient is in the exam room or perhaps afterwards. But with Clear, we can ultimately enable the patient to share that information before they've even physically shown up at the facility. So now the patient is effectively pre-linked or pre-registered with Clear. We're not just a digital identity, right? We like to think of ourselves as a phygital identity. And so when the patient presents at the clinic or the facility, they can effectively use their smartphone. They can scan a QR code sorry, it's not playing. They can effectively scan a QR code at the clinic. That will bring them into a verification flow. So effectively what they're doing here is they're actually saying, I am now here, right? I'm here for my visit. Francois is already enrolled in Clear, right? And so he didn't have to re-upload his driver's license. He simply took that selfie, and then boom, we checked him in for that visit. The front desk and the folks in the back know that the patient is here, and now Francois can sit down and hang out and wait for his provider to show up, hopefully on time. So I've talked a bit about the consumer experience. I'm going to turn it over to Alex.
Yeah,
to
so
speak about how we're making this work in the back end.
For those of you that weren't in the last session where we kind of dove into the Health Gateway Service, but what happens in the background is once we kind of get the trigger from Clear, we go out to the national networks, we pull information for that patient because we now have the demographics from Clear. So we say, okay, where does this patient have data? Pull the documents back, aggregate them, and then we can present that back into the operational system, the EMR, whatever the clinical application is. So that's all automated now. And you have, through these national networks, you have, millions of records available. So especially if you're showing up somewhere where you've never been seen before, right? The hydration of that data takes away a lot of the, what are you allergic to? What are your meds that you're currently on? Like the clipboard that you always have to fill out. So Jason showed that image where you can either have the patient consent directly through the app, right? They can say, okay, here's the medical information, yes, consent, and it'll push it into the EMR. Or you can kind of do a two-step where Clear just takes care of the demographics, and then in the EMR, the provider gets the chance to say, all right, there's data available outside of my system for this patient, click on it, and then populate the EMR with that information. So it depends a little bit on how you want to do that. So you can either drive it through the patient consent, or if it's for treatment purposes, you have the right to pull that information in anyway. And this is just one specific EMR, but it could be any clinical system that we're pushing that data into. Anything else I forgot?
I would just say that, from a Clear perspective, we're already working with healthcare organizations. So some of the use cases that we just showed are already live. So for example, with Wellstar Health, we power that check-in flow that we showed when Francois showed up at the facility. What's great about this is that we can effectively start to build on top in partnership with InterSystems, with both some of our health system partners as well as many of the organizations that InterSystems work with, and effectively just turn on these flows as an incremental value driver for a patient, for a healthcare organization. So this is an incredibly exciting unlock. We've been talking about patient mediated data exchange for years, and thankfully we have some tailwinds from the federal government, at least in the US, to help make that happen. This is a way that we can actually make that a reality.
And I think this combined service is really exciting. I do think this is just the beginning, right? So he was talking about MyChart, for example, having the patient sign up with Clear there, resetting their password. Well, we have personal community. I could foresee us going to that next, because that's directly an application that the patient uses. So it makes sense to kind of integrate more seamlessly with Clear there too. I think you bring a lot of experience from other consumer-oriented industries that'll help us.
100%. Yeah, we work with, just to give you a couple of examples, with LinkedIn, which I mentioned. We work with the Home Depot to reduce fraud for rental pickup, rental car pickup with Avis, budget group if you're ever picking up a rental car. So all these moments where you're required to prove that you are you, we can ultimately unlock those flows. And obviously unlocking your healthcare data is complicated, expensive, and incredibly important to ultimately provide the best care and let the patient and the provider focused on what's most important.
Thank you. Any questions? But I won't be offended if you want to go and get drinks.
Yeah, I want to go to the Smithsonian, but happy to answer any.
Yes, yeah. Josh.
Absolutely. So, for example, right, in the US, you're required as a healthcare organization to identity proof of physician before you can even kick off their credentialing. And so we can actually send a text to the provider from their couch. They can go through that same flow, consent to share their information, and then you can onboard them. Now you can give them access to the EHR, you can give them access to various ancillary systems. So we were talking about this in the context of a patient today, but we have many use cases live from the provider side. So for example, like a really simple use case would be account recovery for a provider. So given some of the cyber issues we've had, across the country, we work with University of Miami Health, for example, and they now use Clear to prove that the workforce member is in fact the workforce member before they give them access back into that digital front door.
And I know we're talking about provider directory with you guys, and we've started that conversation too.
Yeah, it's a great question. So first of all, we're Clear. One of the things that makes Clear unique in this space within healthcare is that we're a fully opt-in platform. So we will never sell or rent your data. That's a little bit different than how some other identity companies operate in the space. We will always obtain consent, and that's what that screen that went through quickly that asked for my name, date of birth, etc. So think of that as the consent. Think of that as a node. So any organization that we partner with can effectively customize that node for each use case. So we think about it, and I know you guys do as well, from a minimum necessary data principles perspective. So if you just need my name and my date of birth and my allergies to check me in, I'm just making that up, that's all we'll obtain consent to share. If it needs to be a more robust data set, then we'll add those layers on. The last thing I'll just mention is one of the things I glossed over is we have what's called a link ID. That's effectively an enterprise identifier for that patient. So the first time that Francois goes through that flow and consents to share his data, that link ID is established between my Clear identity and what do you guys call it? Happy Horizons Healthcare. And then every single time that patient goes through that flow, we'll just leverage that same link identifier. So it effectively eliminates that patient matching issue over time. Absolutely. Yeah, so it can be done both, like digitally, or even if you think about like enabling a provider to access a shared workstation, for example, it could be leveraged to use that.
Okay, thank you guys.
Thank you.